Hi, good morning. Hi, Doc. Uy,
Hi,
ang bigay
Doktora.
I love it.
Ayan, si Dr. Christine Longos-Non. Tama ba? OB-Gyne Allied Care Experts, ACE Medical Center, Valenzuela, Fellow ng Philippine Society of Ultrasound and Obstetrica and Gynecology, Fellow ng Philippine Obstetrical and Gynecological Society, Diplomate ng Philippine Obstetrical and Gynecological Society. Wow! Ang
Hello
haba.
po. Welcome sa bahay. Pero first time yata ni Doktora dito. Ano?
Oo.
At ang pag-uusapan po natin ay Placenta Previa. Yes. Doc, ano yun?
Ano yun?
Placenta Previa.
Placenta previa is an obstetrical complication wherein the placenta is abnormally implanted either totally or partially occupying the lower uterine segment. It usually the most one-third of all leading cause ng antepartum hemorrhage siya. Out of every 250 births, nagkakaroon ng placenta previa.
Doktora, paki-explain po muna para sa mga hindi nakakaalam kung ano po yung placenta.
Ang placenta yung tinatawag natin sa Tagalog, inunan ng bata.
Hindi yun yung matres, iba
Hindi
pa yun.
po. Ang matres yung uterus. So, yung placenta siya ang nagpo-provide ng nutrition and support to the baby.
Oh, I see.
Ayan.
Di ba may tinatawag tayong parang marginal placenta previa at saka merong complete na placenta previa? Ano po yun?
There are 4 types na ng
four,
previa. We have yung low-lying, which yung placenta located siya sa lower uterine segment, pero hindi niya ino-occupy, ino-obstruct yung part ng internal os o yung tinatawag na part na sa cervix. Another type, yung partialis or partially totaling yung internal os o yung marginal, nasa gilid na siya ng internal os but not totally occupying or obstructing the internal cervical os o yung totalis, yun ang pinaka hindi maganda, yan yung nasa left corner natin, totally covering yung cervix natin ng internal os.
Bakit nagkakaganon po? Anong cause
Actually,
niya?
the etiology is still unknown. Pero ang hypothesis, it is due to an abnormal devascularization ng endometrium caused secondary baka by trauma or atrophy ng endometrium. Pwede secondary to trauma nga, surgery, or infection.
Pero pag ganyan, normal mo pa rin mailalabas yung baby? Or may risk factor like for example, kung C-section ka compared sa normal?
Yun, the mode of delivery depends pa rin sa clinical status ng mother, ng baby, saka ng ultrasound finding on what type of placenta. So, actually, there are these factors talaga for having a placenta previa. Number 1 na din dyan, maternal age. If you're more than 40 years and above.
Kaya nagkakapal.
Yes,
Kailangan mag-anak na.
If you have history rin ng placenta previa before, yung recurrence rate tumataas 4 to 8%. If you also have a history ng previous cesarean
Tama ba
section.
weight?
Weight, wala naman.
Anong sabi mo?
pwede ka
Wait
rin.
lang.
Kinabahan ako sa age.
Dok, para mas malinaw, dito explain natin dito sa ating board,
Yes,
sa ating LED. Yan, pwede po kayo tumayo dyan.
Yes, ma'am.
Yan, para ma-explain ninyo. Kung ano po, bakit yung itong sa kabila, nasa gilid yung placenta, tapos itong nasa bandang ibaba.
Ito yung tinatawag natin inunan o yung placenta. And this is the cervix. And this is the external os in the internal os. So you can see this is the baby. So the edge of the placenta is located at or near the internal cervical os, but not completely obstructing the internal cervical os. Ito kasi yung nagdadilate, bumubuka tuwing manganganak tayo. Lumalabas dyan ng bata. As you can compare here, the placenta is totally overlying the internal cervical os. Yung tinatawag natin totalis. Previa totalis.
So, yung ganyan na stage, ibig sabihin, kasi nakabaligtad pa siya, ibig sabihin, hindi pa siya manganganak. Diba?
Not necessarily. Depends pa rin sa aging ng bata niyan. Pero as you can see, di ba, pag may mga previa, 35% usually nakikita namin malpresented ang baby. Either breech sila, naka-oblique ang position nila, o transverse lie. So may hint ka na bakit ganun yung ang presentation ng bata. Either you look for the placenta, baka nag-obstruct yung placenta.
That's
Kaya hindi siya
why.
Question lang ako, Doc. At what ilang months madedetect kung itong naka-cover itong placenta or at saka paano siya madedetect kung sa sa
gilid.
ultrasound
Yes,
or
oo.
sa
Usually, you suspect talaga if you have antepartum hemorrhage, diagnose Previa, magsususpect ka na as early as 24 weeks and above. Okay? And most commonly, nag-present yung mga bleeding na yan during 32 weeks and mga late mid-trimester ng pregnancy. Nag-experience sila ng hemorrhage. As kung makikita mo, ang main hint sa'yo, painless. Painless yung bleeding nila. Wala silang nararamdaman. Then, sudden gush of bleeding, magkakaroon na lang sila. And by abdominal examination, kung ikaw yung clinician, makakapa mo the abdomen is soft, non-tender, the uterus is relaxed. So, may hint ka na baka previa yan. You're dealing with a placenta previa. But for all clinicians, you must remember, do not do a vaginal examination to further not aggravate bleeding.
Kung maaga po ito na-detect, pwede pang maayos o maging safe itong paglabas nitong baby.
Actually, yung pinakamaganda, if you have na ma-diagnose mo agad ang placenta previa, the risk, mababawasan mo yung risk for maternal mortality as well as perinatal mortality. Yan ang kinagaganda dyan. But the mode of delivery pa rin, it will depend, nasa katulad sinabi ko, yung clinical status ng mother, ng fetus, as well as kung anong ultrasound finding mo. Not necessarily, not all previa are delivered by cesarean section. If you have a low-lying placenta, as long as you have an ultrasound image finding of the edge of placenta at least 2 centimeters away from the os, you can attempt for a vaginal delivery, but with an anesthesiologist and an obstetrician around for an emergency case, cesarean section.
Iba pa po ba yan dun sa placenta accreta na sinasabi nila?
Oo, iba naman ang placenta previa. If you have a placenta previa, pwede din siyang predisposing risk factor para
Sir,
placenta
accreta?
accreta.
Okay.
Oo.
Dok, kapag ba kumari sa first baby ko, nagkaroon ako ng ganyan, ibig sabihin sa mga following babies ko, magkakaroon na rin ako.
As I said before, meron kang risk ng at least 4 to 8% na mag-recur uli yung placenta
Mag-ulit.
previa.
Does it come with the genes? Kapag mother mo nag-anak na may placenta, ano siya?
No,
Previa,
actually, it's more of kung meron trauma talaga sa lining ng matas yung the endometrium. Like kung may previous history ka nga na cesarean section, may mga OR, myomectomy or DNC, pwede kang magkaroon ng placenta previa.
Wala-
Does this come with other symptom besides bleeding?
Hindi. Ang
Wala lang,
pinaka-main
bleeding
symptom mo, ang hint mo talaga dito is meron kang painless vaginal bleeding
Painless.
24 weeks and beyond.
Dok, meron bang way para ma-prevent to? Kung wari, like I said kanina, parang kapag nagkaroon ka na sa first baby mo, may chances na magkaroon ka ulit sa mga following babies mo. Pero is there a way para ma-prevent na maulit? Wala
Actually,
na.
wala eh. Kasi ang pinaka-etiology na iniisip dito, may trauma, may gas-gas, o magkaroon na ng
Binuksan.
problema doon
Nabuksan
sa
kasi.
lining ng matres o endometrium na tinatawag natin.
Ayan, eto meron tayong ano dito, Doc. Meron tayong photo ng normal placenta.
Oo. yan.
Nandun siya dapat.
Yes, oo. Should not overlie the internal cervical os.
How do you monitor, Doktora, yung mga prenatal, no? Like if your patient is predisposed to the possibility of placenta previa and prenatal checkup will be a tantamount indication in the next pregnancy, how do you give or how do you ask your patients na every 3 months, every fourth month, or the 4th month, yung check-up per se?
The routine prenatal checkups pa rin ang i-advise natin sa mga pasyente natin, okay? But for me, I recommend my patients to have an ultrasound at least a second trimester ultrasound, a mid-trimester ultrasound, and at or near term to locate the final placenta localization. So you can determine what really is the type of the placenta previa. And I recommend do a transvaginal ultrasound to be done instead of a transabdominal ultrasound to accurately determine the edge of the placenta.
Yan, dami natin natutunan ngayon kay Doktora. Doktora, para pagka naisipan magpa-check up ni Rina at ni Monica, saan kanila pwedeng makontak?
Yes, so we are all inviting all our patients and all our who are concerned for an prenatal checkup as well as iba pa. We are we're giving the best services and specialists in Allied Care Medical Center, which is located at 584 MacArthur Highway, Valenzuela City. Okay, as our hospital stands for ACE, always caring with excellence. So please come visit us in our hospital.
Ayun. Thank you very much, Doktora.